Hi, counseling students. My name is Nicole Stargel, and I'm going to explain the field placement procedures in this brief video. So here is my contact information, and when we go through the procedures, I will explain to you that 2 of your field placement application documents should come to me as a hard copy. And this is your site supervisor's information, and this is also your signed contract, which will include hard signatures from the site supervisor as well as the site administrator. So those 2 forms are going to come to me as a hard copy, and you'll submit those to me in my office, which is Education Building 341. It's the 3rd floor, and we're in like the center cove where the GA offices are. And typically there's a field placement GA whose office is 343. So if I'm not here, you can leave it with the field placement GA in room 343 of the Education Building. But also on the 1st floor is a set of mailboxes, and Miss Lori's office is right when you walk in the front door of the Education Building, and the mailboxes are to the right side of her office, so around the corner to the right when you walk in the front door. So those are all the options that you have for submitting the hard copy forms, those 2 forms that we'll talk about in a little bit. And then otherwise you can email your forms to this email address. You can always call me. There's my office and my cell phone number if you've got any questions. But email is also the best way to send me a question if you've got one for me. And then there shouldn't be any need to fax anything, but there's my fax number in case that is what you need as well. Mostly the information that you're going to be submitting is going to be through Qualtrics, so like online survey forms for your field placement application. So we'll go ahead and jump into that material, and I'll tell you which forms need to be submitted. But otherwise, here's my contact information. I do the field placement coordination, so any questions you've got, just go ahead and send them my way. So if you're watching this video, you're probably contemplating beginning your field placement, and field placement should occur in your last 3 semesters. So that means that when you finish internship 2, you should be also graduating that semester. So what you do is the first semester of 3, you take your practicum. If you're a clinical mental health student, you can take practicum over the summer. If you are a school counselor, you have to start practicum in either the fall or the spring semesters, the full 15 weeks. And practicum is 100 hours, and since our semesters are about 15 weeks, I still suggest going to practicum 10 hours per week, which will give you 150 hours roughly, but you know, give or take a few. But see, the most important part is that you get 60 hours of direct contact and 40 hours of indirect. And direct client contact is actually sitting with a client doing counseling. So the reason I say to go 10 hours per week even for practicum is because at the beginning of practicum, you're going to be learning about your site, doing trainings, and just kind of getting acclimated before they're going to give you clients to actually see. So those first couple of weeks are not going to count towards your 60 direct hours. So I would definitely recommend 10 hours per week, and just keep in mind you do need to have 60 direct contact hours with clients per week, or total, and so rounding it out for the week, that's at least 5 or 6 direct hours once you kind of get into the flow of it. Okay, and then for internship 1 and 2, you do internship, and that's 6120 for clinical mental health or 6130 for school counselors, and I would suggest going 20 hours per week. Now that is cutting it close. That's actually a modest estimate, but the assumption is that you've already integrated yourself into the setting during practicum, kind of started to build a caseload, and you can hit the ground running. Because with 20 hours per week times 15 weeks, that's going to give you exactly 300 hours, and 180, that's 60%, need to be in direct client contact, which means you actually have to sit with clients for 12 hours per week. And with a no-show rate of 40% or so, that means you actually have to schedule 20 hours of actual client contact and then account for no-shows. So internship, getting your hours can be incredibly challenging, and you have to work very diligently at it. So if it were me, I might schedule 22 hours per week just to give myself a little bit of a cushion, but that's up to you. You can do it in 20, especially if you have a low no-show rate at your internship site. So backing up, you're thinking about starting 6100. practicum, the 100 hours, 60 of it in direct contact with your clients. In order to do so, you have to complete the prerequisites. For us, that means these core counseling courses that are listed here, and there's 9 core courses. If you started before fall of 15, you must just complete all 9 of these courses. So if you started in spring of 15, fall of 14, or before that, your job is to complete all 9 of these courses and then apply for practicum whenever you're ready and when you have 3 semesters left to go. However, if you started fall of 15 or later, so that's fall of 15, spring of 16, fall of 16, spring of 17, you are going to complete 8 of the 9 counseling courses, and of these 8, you have to do 5,000, which is the ethics, 50, which is skills, and 5,100, which is group. And then you also complete the clinical mental health counselor or the professional school counselor, which is 5350 or 5450. That's not listed on this previous slide. You'll see that that is not listed as a core course, and that's why for students coming in, what we want is we want you to have your professional course, either that 5350 or 5450, before starting practicum, and then you complete your 9th core course simultaneously. So if you're registering, if you're taking 6100 in spring, then you also register for your last core course at that time. All right. Everybody's responsible for finding their own site. It can be a challenge, and I suggest as soon as you kind of start to know that you're going to, when you're going to start your field placement, that you start looking and putting out feelers. There's some really important requirements that every site has to meet. And so what you end up doing is you find a site, you fill out the paperwork, and then you submit it to me as an application, and I'll approve it. What I need to see is that your site supervisor wholly believes, because they can't guarantee that you're going to get your hours, but there is a place where they have to say that they fully believe you will be given the opportunity to earn your direct hours. 180 direct hours in a semester is a lot. 60 for a practicum student who is brand new, it's a lot. So it takes a commitment, and that's what we need to hear from your site supervisor, and that's on the paperwork that they'll fill out. That's one of those hard forms that we actually get a signed signature from the site supervisor, that they believe you will be given the clients and the opportunity to do 60 direct hours for practicum, 180 for internship, and within those it has to be a mixture of individual and group hours. As far as your supervisor goes, they have to have 2 years experience working as a counselor. That's mandatory. For school counselors, your supervisor has to be an LSC, a licensed school counselor working in the school. The only time you would be able to have an off-site supervisor as a school counselor is if you were hired as a school counselor and you were the only school counselor in the school. So then your supervisor would be at the neighboring school within the same district. So, you know, kind of the senior school counselor within the same district. For clinical mental health counselors, there's never an option to have an off-site supervisor. For clinical counselors, you always have to be at the same site as your supervisor. And for both clinical and school, you're never allowed to have 2 practicum or 2 internship sites at once. You are able to switch between practicum and internship 1 if you want to try something new, and then between internship 1 and internship 2. However, in any given semester, you have to have 1 site supervisor and 1 site. So now back to clinical students, you always have to have your supervisor on site, and the preference is that they're an LPC. So an independent license is just, you know, plain old LPC. A provisional license where they're still getting supervision is an LPCA. And some people can work full-time toward their LPCA and have 2 years of experience but still not be fully licensed, and that's fine. If they're an LPCA, that's fine. If they're working part-time and they still are able to supervise you and give you what you need, that's fine also. So you can have an LPCA, a full LPC, and you could even have an LPCS, which is a fully independent clinical counselor with the supervisory credential, but you don't need it. Bare minimum, 2 years experience, LPCA. That's the preference. Clinical sites are a little bit tougher to find, and sometimes we have to branch away from LPC into related but separate disciplines, like a licensed clinical social worker. That's pretty much the most common. If you're interested in addictions, like a licensed clinical addiction specialist. And we can take that on a case-by-case basis, but please do look for an LPC, a licensed professional counselor, and that will help you to learn the identity of a professional counselor rather than the identity of somebody in a related field. So I kind of worked my way up from the bottom, and you've seen this top bullet, videotapes. That is one of the most key and difficult things for students. We require that you bring videotaped counseling sessions to your university supervision. So that means when you come to 6100 class, which is a hybrid class, so every other week you meet with your professor, which is your university supervisor. It might be me, Dr. Warren, Mr. Wentz, and you would meet with them plus 5 or 6 of your classmates, and you show a tape of your counseling. And the video only has to be of you, but it has to be video. It can't just be audio. So your site has to allow you to ask clients for permission to videotape sessions. That's your responsibility to do that, and I know it takes a lot of gumption and you know, a lot of energy to kind of make that happen, but it's a requirement. Some supervisors, some university supervisors will require 5 tapes, others might require 10. It just depends. So your site has to be open to allowing you to request that you videotape sessions. And like I said, it only has to be on you, but we do need to see your body language. We need to see the interaction in addition to what's being said. So when you're looking for a site, make sure that you're thinking of those 3 criteria. Is my supervisor qualified? Am I going to get the hours that I need? And am I going to be able to videotape some of those hours? All right. So here's the part I was talking about, the forms that come to me for a field placement application. You'll see the field placement manual, and the new field placement application, there's a link for it in the manual. When you click the link, you fill it out on Qualtrics. It's like an online survey. You tell me your name, you tell me which classes you've completed, do you have any incomplete classes, how can I contact you, those sort of things. So that's your field placement application. You only do it once, and it's online. The site supervisor information card, that's where the site supervisor tells me their credentials, tells me that they believe you'll get the hours that you need, and tells me that they will meet with you for 1 hour per week. That's required. They have to sit and give you supervision 1 hour per week. And that can be, you can have additional group hours at your site, but you've got to have that 1 hour per week with your site supervisor sitting down talking about your experience. So that's Form B. It's a hard copy because I want your site supervisor to fill that out and sign it, and that's what you deliver to me in person, along with the contract, like I mentioned, which is Form C. Print that out from the manual, have your site supervisor sign it, you sign it, and the administrator. So for a school, that's going to be the principal or the central office. If you're in Robeson County, it's going to be the central office. Otherwise, it's probably going to be the principal. For a clinical site, that would be whoever is your supervisor's boss. So if your supervisor doesn't have a boss, they should sign that twice, like if they're the owner of a private practice. The purpose of that is so that the highest person knows that they've got an intern working in, serving clients in their setting. And then the final thing is a PCA, which is a professional competency assessment, and you complete it, and again, it's an online Qualtrics form, so Form D, you click the link, you fill out an assessment on yourself. How well do you reflect? How well can you sit with clients and understand what they need? And then you also ask your advisor to complete the form as well. So I know I'm an advisor for a lot of the clinical students who came in for fall of 15 or spring of 16, so then you would ask me to do it. Or if Dr. Che is your advisor, you ask him, Dr. Jones, it could be Dr. Warren, Dr. Mock, Dr. McDonald, have your advisor complete a PCA as well. So those are the 4 forms that are required. Your new field placement application, you complete it online. When you hit submit, it comes right to me. Your site supervisor information card, Form B, and the contract, Form C, print those out as a hard copy, get the signatures, bring those to me. 341 Education Building, the GA's in 343, my mailbox is on the 1st floor. Drop those off by the deadline. There's a deadline that's about 2 months or a month and a half before the end of each semester, and I send out emails to tell you the deadline. So complete Form A online, drop Forms B and C to me in hard copy, and complete Form D, the PCA, online, and have your advisor complete it online as well. That's the process. All right, so when you first start on site, that very first class, I will meet with you again. We're going to meet as a large group, and we'll go over some other important information that you need to know when you're starting field placement. But what you do need to know, just have in your mind right now, is that you cannot start accruing hours on site until that first field placement meeting. Typically on a Tuesday, it might be on a Wednesday, but that first week of class, you have to come to class first before you can start going on site. If there's special trainings or orientations, then email your university supervisor and request to be able to go to those. But otherwise, don't start on site until you come and meet with your university supervisor on the first week of classes. And when you come to class, bring proof of liability insurance. You can get this through ACA. You can get it directly through HPSO. You just basically Google. You can just search for counselor, student, liability insurance, and you have to have a $3 million slash $100,000 policy, and that information is in the field placement manual. If you've got any questions about that, let me know. But if you join LPC-ANC, ACA, which is the American Counseling Association, or ASCA, the School Counseling Association, you get free liability insurance. So I would suggest joining one of those organizations, printing out the liability certificate. It prints out almost instantly, and then you have your own liability insurance. That's required. It's not an option. The site has insurance on themselves. The university has insurance on itself, and you need to have insurance on yourself. The final thing that I'll note, and all of these things we'll go over more on your first day of class, is that during 6100, your practicum, you are required to sit for the counselor comprehensive exam, which is your COMPS. So the comprehensive exam is 300 questions, and you should be studying through for all of the different topics throughout your core courses, and so we'll talk more about that, but do be prepared as you're sitting to think about applying to begin your practicum. Also know that toward the end of that semester, you're going to have to sit for the Counselor Preparation Comprehensive Exam, CPCE. And so your practicum university instructor will take time to guide you through that process, but what I would suggest is starting to study now and start gathering your resources from your past core courses. Hopefully your professors have been kind of reminding you that this is going to happen. And then also I suggest the Rosenthal text, which is the Purple Encyclopedia. So just know that every 6100 student is required to sit for the CPCE, and if you started from fall of 16 forward, so it's fall of 16, spring of 17, if that was your start date, then you are actually required to pass the CPCE before you can move on to internship. So it's a very important test, and it's not an option. You've got to pass it, and it could actually delay your graduation. It can delay your graduation for any student, but especially those starting in fall of 16 and beyond. So that's pretty much the basic contents, and if you have any questions, call me. 336-609-6968 is my cell phone. 910-521-6898 is my office phone, and the best way to get a hold of me is by email. So I know it's a lot to take in. Review the field placement manual. All of the information is in this video if you have to watch it a couple of times, and call me or email me with any questions. I look forward to working with you, and my door is always open when I'm here, so stop by anytime, especially during my office hours. I look forward to working with you in class and throughout your field placement and your testing. Have a wonderful day.